Hello guys, and welcome to this video to learn all the steps of sinus floor augmentation or sinus lift, okay, which is basically the sinus grafting procedure when we want to recover, the bone height that was lost due to, of course, bone loss and sinus pneumatization. Okay, so those are two different events that happen, especially when we have edentulous areas. So now take a look at this case. We are going to use this case to explain the steps. So medical history, there were actually some important aspects to be discussed, but we are going to discuss about this entire case in a future video. Okay, so let's focus about the sinus lift procedure and the implant planning procedure. Of course, the medical history allows the patient to be submitted to a surgical procedure. As you guys know, uncontrolled diabetes, uncontrolled metabolic diseases, for example, would be contraindications, or especially could be, depending on the situation, contraindication for surgeries like this, right? So sinus lift surgery, for example. So we should always be careful about that. But here in this case, we are seeing two different alterations, okay? So we are seeing the horizontal bone loss. So there is bone loss, the level of the alveolar crest. Take a look at the teeth. The level of the bone is in the middle of the teeth now, right? So it's in the middle third of the roots, okay? Of course, there is still no mobility, but we lost some bone. And there was, I'm going to tell you guys that this patient had periodontal disease before, but he had undergone all the periodontal treatment, and now the level of the bone is stable, at least, okay, being followed up since at least some months, and now it's stable, so without active periodontal disease or infection, okay. Yeah, you guys are seeing also that this patient was, before coming to the clinic, he was submitted to a root canal treatment of the second premolar, as we are seeing here. And then there seems to be a lesion healing. Maybe, of course, we need to follow up as well as the patient came now. But okay, we are seeing that the level of the radiolucency or radiopacity could now tell us that we have some healing. Okay, so you guys could always take a periapical radiographs to see the situation in more details. Okay, but at least this seems to be a healing situation. So we are going to plan now the rehabilitation. We need posterior teeth to protect anterior teeth, and the patient needs anterior restorations and so on. But before that, of course, if there is no periodontal disease and no urgent situations, then we would proceed with the rehabilitation of the posterior area, okay? Now, the patient needs two molars here, but this is an elderly patient. The lower arch has only until the first molar, and the patient decided that he wanted only the first molar, okay? But still we need to do sinus lift for this situation, okay? And we need to recover this bone area. So the sinus is pneumatized as well, which means that the sinus increased in volume due to intra-antral pressure, okay? So I will also add the link of the sinus anatomy video. So if you guys are in the beginning of the dental course, or if you guys are not ready to learn all the sinus lift steps, please go back to my video of sinus anatomy and of my video of how to open periodontal flaps. Okay, this is very important as well. I will add both links on the top right corner of this screen. They will show up at some point. All right, and then we have this situation. So you guys are seeing that we have sinus septum as well, but the sinus septum is posterior to the region that we are actually interested, so it's not a problem, okay? And then this radiopaque area posterior as well, so in the top left corner of this image is basically the zygomatic bone and the zygomatic process of the maxilla, okay? You guys can always go back to my videos about radiographic anatomy if you guys are not sure about that. Okay, now we have important aspects on the screen. We need to assess the remaining bone conditions. Basically, there's actually, almost no remaining bone height here. Just the alveolar crest is there, a little bit more than that. Sinus volume, so we need to plan the volume that we want to graft, and we need to detect the anatomical variations, such as the sinus septum. Other variations would be a very thin wall of the sinus, okay, so the lateral wall that we want to open to do this technique, okay? Because in this video we are going to cover the lateral wall technique and always following the implant planning. So ideally you guys plant the prosthesis first, okay, like a waxing or a digital waxing if we are talking about digital dentistry, and then we want to plan our implants. And after this we want to know where we need to replace bone, right? So this will be the correct order of planning. But all right, so let's see how this was done actually. After the planning, of course, then the first step, now I'm talking about the surgery, would be, of course, to open a flap. And there are many flaps acceptable to do that. You guys can go back to my video of periodontal flaps if you need. This is just a trapezoidal flap, so with two releasing incisions, okay? So the mesial releasing incision is basically starting on the mesial aspect of the buccal surface of the second premolar, okay? And always going divergent, okay? Going divergent because then we have a larger area. Ideally, our base should be longer than the height of the incision, which means that the crestal incision, which is the first one that we do, should be longer than the releasing incisions, okay? And you guys will actually see that I had to increase the length of this flap. So I had to actually increase the length of the crestal incision, the horizontal incision, okay? Now, how to do this horizontal incision? So, of course, you guys would go 90 degrees with the scalpel blades, then we proceed with 45 degrees, and then we finish in 90 degrees as well. So 45 degrees and then finish again in 90 degrees, and then we remove our scalpel blade. So this would be your crestal incision, right? Then you would proceed with the envelope incision only for the second premolar until the mesial aspect of the buccal surface, where you would open your releasing incision, all right? If you need, you can open a posterior releasing incision as well, just like you guys are seeing in this picture. And what we exposed? We exposed the lateral wall of the sinus because we want to open the lateral window, okay? That's the lateral window technique. And now you guys are seeing the lateral window. How we opened this? This was done with a piezoelectrical surgical device, which has the advantage of not damaging soft tissues, so it only cuts hard tissue. I'm also recommending this article from myself and collaborators, of course, published in the JOMI, in the International Journal for Maxillofacial Implants, for you guys to see how this can be done with the piezoelectrical surgical device, okay? But you could also use a spherical burr, okay, to do that. So there you have it. You have the lateral window, of course, containing the area that we want to rehabilitate, to put our implants, okay? And then we start to elevate the sinus membrane, right? So we have the sinus membrane, which before was called Schneiderian membrane, and now we need to elevate this membrane. So this is actually a two-step procedure. First, we can start with the piezoelectrical surgical device. This is the elephant foot tip of the piezoelectrical surgical device, which is basically not cutting soft tissue, only hard tissue. And then this allows us to elevate the membrane without damaging the membrane. Okay, so you would use this to start detaching the membrane from the bone, but then of course you can do this, especially the rest of the procedure now, with the curette. Okay, so you would use the curette, the concavity of the curette facing the bone, okay, so facing the sinus floor. And the back of the curette would elevate this membrane, okay, so always touching the bone, all right, always touching the bone, and then you would go slowly elevating the membrane until the palatal aspect of the sinus, okay. Mesial distally as well, you should do that throughout the area that you plant, okay, so this is very important. And then you would be able to insert the grafting material on this or into this window. Of course, you guys need to understand that this material should be packed in the direction of the sinus floor, of course, especially at the beginning, and which material we can use. So this is, there are several actually, but this is a particulate sinus graft material. It's a particulate bone substitute, which is the bone ceramic from Straumann. So it's basically biphasic calcium phosphate, okay? But there are other options, of course. Then after you fill this window, then you would proceed with a collagen membrane to close the window, okay? And this is very important because if you need to reopen the window, then if you but the collagen membrane is so much easier to reopen. So this would be the correct procedure, even to avoid, to prevent soft tissue to getting into this grafted area. Then you would close the flap, you would suture the flap. You could use Vicryl sutures, resorbable sutures, for example. And then, again, we'll go back to our video of suturing if you need. And then we have the implant planning 6 months later. Even the graft planning you could do with a CBCT. Okay, that's actually allowing you to do in 3 dimensions, and always when we need 3D information, all radiation guidelines will allow us to use the CBCT, because that's better for the patient. So for implant planning, for example, you guys are seeing the implant planning. We are seeing that the graft was stable, the graft is in good conditions, and now from left to right you have the axial window. Okay, now you have in the middle you have the coronal panoramic window, showing that the lesion is still healing, for example, of the premolar, or not. So we are following up the situation, of course, but our graft is still there, away from the septum. Take a look at the septum, okay? And the most important plane that we need to use to plan our implant is, of course, well, all of them, but the most important would be considered the cross-sectional plane, okay? Or here would be the coronal plane as well, which is the one on the right side of the screen, okay, so the last one. And then we are seeing that part of the implant is still on native bone, and the apical part of the implant would be entirely on bone grafts, okay, and that's perfectly acceptable. Now, after this, of course, you would place your implant, and you guys can see that the direction of the implant was pretty much in line to the planning. You could use image-guided surgery. In this case, it was just a open flaps, freehand surgery, and then just a small flap. To do that, you could do release incisions if you need as well. And then after this, you would take a periapical radiograph to make sure that everything is fine. Okay. Of course, this periapical radiograph is oblique, the way it was taken, but the implant allows for the rehabilitation of the site, right? And we can see that, take a look at the area of the periapical lesion of the second premolar. Now it's healing. We can see that in the periapical radiograph that the radiolucency of this area is also similar to the radiolucency of those mesial areas, right? Because this patient had also, this patient is elderly, and the bone may vary from patient to patient, the density of the bone. That's the density of the trabecular bone. So we are going to still follow up, of course, but it seems that this lesion could be healing indeed. It's not so radiolucent like lesions are in general. And even if you compare with the radiolucency of the sinus itself, now there seems to be some bone now in this area, right? So we could consider that it's healing, but we are going to still follow up this situation, okay? Take a look at the screen again. Important aspects, always prosthetically driven, because if the implant is supposed to support the prosthesis should always be planned beforehand, before the implant. Okay, that's the correct order of procedures. And of course, as part of an integrated dental treatment plan. So of course, in accordance with the medical history, in accordance with the dental history, with the chief complaint of the patient, and in accordance with the occlusion of the patient and all the other aspects. So always being part of an integrated dental treatment plan. Okay, even though we are using this video only to comment the sinus lift steps. All right. So if you guys liked, please hit the like button, share the video, and see you guys in the next videos.